Essentially 3 trials that I'll be discussing that apply to 3 cohorts of patients. So the first trial is the collision trial, which applies to patients who have resectable liver-only colorectal liver metastases. And essentially it's a comparison between ablation and resection for that cohort of patients, with the primary finding being that ablation was non-inferior to resection. We can't yet label it better, but it's non-inferior to resection for patients that have small-sized liver metastases that are ideally located. So the second trial was the TRANSMET trial, which pertains to patients who have unresectable liver-only metastatic disease, and it essentially shows that liver transplant was far superior to chemotherapy alone for that cohort of patients, with an estimated 5-year survival in the range of 70% as compared to 10% for chemotherapy alone. And then the third trial is called the ORCHESTRA trial, which pertains to patients that have disseminated colorectal cancer, so more than one site of disease in the metastatic setting. And the comparison groups were chemotherapy alone or chemotherapy plus surgical debulking. And it essentially showed that surgical debulking did not improve survival for those patients.